Is open enrollment time, and when you sign up for your health plan for the upcoming year, look out for higher prices. Costs are up 14% for a family plan on average to about $4,000 a year. Joining us now to explain the big increase and what we should do about it is healthcare expert Andrew Rubin. Andrew, why in the world are we seeing this kind of increase?
Well, listen, this has nothing to do with healthcare reform. Long before healthcare reform was passed, employers were shifting costs onto their employees, and this is just a continuation of rising costs in the healthcare system. The insurance companies increase the amount they charge employers, and employers pass that on to their employees.
Okay, so let's talk about how in the world you can try and keep the costs down. Let's look at some of the options. HMO, PPOs often among the choices. You say an HMO might be something you want to consider.
Yeah, you know, HMOs had a bad rap a long time ago. People didn't like the idea of their care being so tightly managed and not having the ability to go out of network. But so many doctors and hospitals are actually in network right now. So if you have to check and make sure the HMO has good coverage in your area. And the premiums tend to be the same for the employee as a PPO, which has a little more flexibility for seeing doctors. But you save all the money on copays and deductibles. They tend to be a lot less in an HMO.
Well, it used to be that the HMO was ideal if you were very young or extremely healthy. Not the case if you already have, pre-existing conditions, etc. You need specialists. You feel like people should change their minds on HMOs now?
Yeah, I mean, the reality is, again, most doctors take insurance now around the country. And, it's up to the employee or the individual to check and make sure their doctors are in the HMO panel. But if you live in the big cities in particular, you're going to find that an HMO is a really good option now. Okay,
and you say regardless of the plan that you choose, you need to stay in network because that means keeping the cost down.
Sure, if you're in an HMO and you go out of network, you're in a lot of trouble. You're responsible for all the costs. But with a PPO, you're allowed to go out of network. And you can actually, depending on how the plan is structured, if you go see an out-of-network doctor, you can end up spending a lot of money on co-insurance amounts. So, if you're going to go out, if you're in a PPO, make sure your doctor's in network.
Okay, and back to those young people and a plan that they may want to choose. You say, look for a plan with a high deductible. Why?
Well, listen, it's always a gamble when you choose a high deductible plan, but there's no question they're less expensive. And if you're a younger adult, a younger American, it's less likely you're going to get sick. Now, that could still happen, and, that would be bad if you had a high deductible plan. But if you really don't have a lot of money and a high deductible plan is an affordable option for you, a younger American might want to consider that because, again, the odds are, more in their favor that they're not going to get sick.
And you also say to maximize your health plan, you need to take advantage of free screenings and preventive checkups.
Sure, we've been talking about this a lot, Frederica. I mean, a lot of employers are now offering screenings and wellness exams, and it's good for your health. It's good for your employer because if you stay healthy, they spend less on the health care. But they also now are offering discounts sometimes offering discounts on the premiums that you have to pay, and they may lower your co-insurance amounts if you participate in the screenings and wellness plans. So, you have to check and see what they're offering. But if they offer it, take advantage of it.
And a lot of companies are offering flexible spending accounts. You say take advantage of that?
Sure. You don't want to, with the flexible spending account, you actually lose the money if you don't spend it every year. So you want to make sure, you want to look at what you spent the previous year on medical bills. Again, it's kind of a gamble how much you put in there. But if you spent, $500 of your own money last year, why not put it in a flexible spending account if it's offered to you, and you'll get the tax benefit of having that money put in there pre-tax.
Okay, and real quick, when it comes to prescription drugs, you say go generic as opposed to the name brand, but oh my gosh, the argument has been for a lot of people that the potency may be different for a generic versus a name brand.
Listen, we hear this and talk about this all the time, and I'm not a doctor, but I have a lot of friends who are physicians. And if it's a generic brand, they tell me it's the exact same thing. And you hear a lot of people say it, and you can't imagine how many people I know who don't do it. If it's an option and your physician says it's okay, go generic. You will save a lot of money.
All right, Andrew Rubin, thanks so much. Good to see you. Appreciate it.
Good to see you too.